There are also things with contrast because you tend to start to lose some of the lighting. One of the common things that happen with diabetic retinopathy is you end up with areas of vision that isn't as clear. So it's not usually a full, kind of change in the vision. It has to do more with sections of the vision that start to go, mostly because of what can occur in the vasculature of the retina. So the bleeding that can occur when the sugar levels get high create patches in the vision where you're not seeing as well. So a lot of times it's more about using and finding those areas that you see best with, using magnification to kind of enhance the vision that is good, and then kind of weeding around those areas of vision that aren't good. There are also things with contrast because you tend to start to lose some of the lighting, in the sense of the retina in areas not seen as well. So you're not really getting the full effect of lighting sometimes. So you can kind of almost be almost blinded, essentially, like kind of with that glare issue. So by using tints in your glasses, outside makes sense as well, but even indoors, using a tint to kind of change the way that the vision is can be really helpful for people with diabetic retinopathy.
With diabetic retinopathy, so that's central vision? Or is that both central and peripheral vision?
It's kind of, yeah, it's central and peripheral.
Okay.
So those patches of vision, the thing about a diabetic retinopathy is you can have diabetic macular edema. That's going to be your central vision changes. So that can get it to a point where you're not seeing that 20/20 vision anymore. But then the patches or the areas that may not see so well is going to be more in the periphery. So you can kind of have both with macula or with diabetic retinopathy. You can have that central vision loss if the macula is involved, and then you can have the peripheral patches depending on where any of the bleeding is occurring.
And does that usually happen at like advanced stages of diabetic retinopathy, or kind of like when does vision loss happen?
It does vary. Yeah. Usually it ends up being when you're not controlled for a long time. There can be years of no changes with diabetic retinopathy. Just little tiny things that we see when we look inside the eye, but not really changing visually. But if the person continues to not control their sugars, or they're either at high levels for a long time, or if they kind of do a lot of ups and downs, like too low and too high, that then puts more stress on the vessels. So as the uncontrolled diabetes advances or kind of increases, then it can also make it worse. So you do tend to see more of the true vision loss from diabetic retinopathy later on, when things, years of uncontrolled diabetic retinopathy.